Thanks for checking out HSH TV. Today's episode is going to touch on ways to create and embrace the best treatment routine for you. Before we dive in, let's review the basics.
What is EMPAVELI, pegcetacoplan? EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. Adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce levels of protein in the urine, proteinuria. Important safety information. What is the most important information I should know about EMPAVELI? EMPAVELI is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. EMPAVELI increases your chance of getting serious infections caused by encapsulated bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI.
Developing a routine is a great way to keep you consistent and organized as you integrate a new medication into your life. The freedom of at-home self-infusion means that you or your caregiver will be in charge of your infusion schedule. Set aside time for yourself. Make sure things aren't rushed. Find a time of day that works best with your schedule. I've actually adopted all of these tips and developed my own routine around what my body needs. I started waking up early, making some celery juice, and then I go outside to exercise, even in the cold New York City winters. My routine has actually become my favorite part of the day. And if I feel rushed in the morning, it affects my mood for the rest of the day. Likewise, I make sure that I take my nighttime routine just as seriously as my morning routine so that I wake up each morning as refreshed as possible and ready to go. My chronic disease has made me understand how important it is to create a routine. But while my routine works great for me now, it definitely took me time to find out what worked best. My tip for you is to try and ease into a weekly routine that is centered around what's been prescribed to you by your doctor and your preferred time of day to infuse. Since each infusion takes either 30 or 60 minutes, depending on how many sites you select, I suggest you pick the same time to self-infuse on your scheduled days and mix in something that brings you a little joy, like watching your favorite TV show, reading a book, an article, or listening to music or a podcast. You could even binge all of the HSH TV episodes. Getting into a groove will help you stay one step ahead. It may take some experimenting to find what works for you in your routine, and that's okay. Don't get discouraged if it doesn't feel right yet. If something doesn't work, take a look at what you can change and don't be afraid to try something new. Who knows, you may find your new favorite part of your day. To get some first-hand insight on good treatment routines, we talked to Rebecca, a chemist, a writer, a mother, and a grandmother. Rebecca does not have PNH, but she has over a decade of experience with self-infusion. Hey, Rebecca. Thank you so much for sharing your story with the HSH crew. How are you doing today?
I'm doing well. Thanks for having me.
Tell us about yourself. What do you do for fun? What inspires you?
Well, since I retired from my career as a chemist and a technical writer in 2001, I've been focusing more on my creative writing. I've written blogs, some fiction. I've actually had one of my mystery novels published, and I'm working on a children's book.
Wow, I would love to read some of that. Now, you've been self-infusing at home since 2009. Would you mind sharing how your perspective of self-infusion has changed over time and also how you've benefited from it?
Sure. When I first started infusing at home, I was intimidated by it. There was a lot that went through my mind, but the main worry was making sure I was infusing correctly on my own. However, I started getting more and more comfortable with the process after each infusion. Since then, I haven't looked back. I do still have to work my personal life around my infusion schedule, but it's not as big of a deal as it was before I started self-infusing. As long as I'm in a place where I can infuse in time for each session, I have the ability to go do the things that I love with the people that I love. I have more freedom to travel too, which was huge for me, especially since I have family and friends all over the country. As long as there's a way to refrigerate it, I just bring my medication supplies with me and infuse when I'm scheduled to.
It sounds like being able to infuse your own medication at home or on the go has given you the ability to experience a new way of living. You mentioned you bring your medication and supplies with you when you travel, which is great. Do you have any storage tips that you've adopted since you began self-infusing? And do you think those tips help you stay organized when you travel?
Yes, absolutely. I have a system I've perfected over the years. I like to keep the supplies I need for my self-infusion in an organized space. I'm lucky enough to have a walk-in closet, so I keep my materials on a shelf in there. Knowing exactly where my medication and supplies are helps me stick to my routine, so when it's time for my infusion, I just grab what I need to get started. This process also makes it easy for me when I travel. I just get the medication supplies that I need, put them in a container that will keep them at the required temperature, and head out.
I mean, that's great. Can you describe how you like to travel with your medication and supplies?
I never check my medication or supplies at the airport, so I end up packing it on my carry-on and going through security with it. Since my medication has my name on it and all my supplies are able to be scanned, it's pretty straightforward. I just explain to them it's my medication and I'm good to go. I find that when everything's organized, it makes the process more seamless and less of a chore.
Speaking of making the process less of a chore, can you tell us about how you've incorporated self-infusion into your routine?
Well, I usually do my infusion after dinner when we're settling in for the night. Then I just head over to the living room with my family to infuse my medication there. Usually we'll watch what's ever on TV. It's really nice for me that I can infuse my medication without having to excuse myself from my husband or kids or grandkids when they're visiting.
That's great. Do you always self-infuse in the living room?
I usually do. I have my whole setup in there. I pretty much always sit in my favorite chair when I'm ready to self-infuse my medication. That chair has everything I need right by it. A light so I can see what I'm doing, and a tray that I use to lay everything out to prep for my infusion.
Where did you get your tray from?
Well, I got it from one of my favorite stores for only $10. It's one of the things that I use most in my house, and everyone knows not to touch it.
Yes, Rebecca, functional doesn't always have to be expensive. I'm so glad you found something that works for you. I have one question for you. What is your advice for people doing at-home self-infusions for the first time, or someone who may have been doing self-infusion for a while but needs some words of encouragement?
Don't give up. Some people may feel like they're not as supported since they're infusing their own medication, but I encourage them to reach out to their support system. You're not in this by yourself. There are so many of us who are there to help.
I love that. We're not designed to go through transitions or difficult times on our own. It's so important to raise your hand when you need help. Rebecca, thank you so much for spending some time with us to help give some insight into what it's like to self-infuse medication at home and your experience incorporating it into your life. I've loved chatting with you.
Thanks, Genevieve. See you soon.
As you can see, no one has the same treatment routine. It is truly all about what works best for you. My routine is my diet, it's my exercise, it's my physical health, and my mental health. I don't feel guilty at all for taking care of myself, though I used to before being diagnosed with my chronic illness. You shouldn't either. Having any disease is far from easy, but without putting yourself and your routine first, you won't be able to help others in the way that you want to. So take the time to embrace what you need in your new routine. Set up your fridge, your supplies, and your home as a whole in a way that will help you incorporate beauty, calm, and healing into your treatment routine with EMPAVELI.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH, adults and children 12 years of age and older with a kidney disease called complement 3 glomerulopathy, C3G, or primary immune complex membranoproliferative glomerulonephritis, IC-MPGN, to reduce protein in the urine, proteinuria. EMPAVELI may lower the ability of your immune system to fight infections. It increases your chance of getting serious infections caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These serious infections may quickly become life-threatening or cause death if not recognized and treated early. You must complete or be up to date with the vaccines against Streptococcus pneumoniae and Neisseria meningitidis at least 2 weeks before your first dose of EMPAVELI. If you have not completed your vaccines and your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. You should also receive antibiotics to take for as long as your healthcare provider tells you. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI. Vaccines do not prevent all infections caused by encapsulated bacteria. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever, with or without shivers or the chills. Fever with chest pain and cough. Fever with high heart rate. Headache and a fever. Confusion. Clammy skin. Fever and a rash. Fever with breathlessness or fast breathing. Headache with nausea or vomiting. Headache with a stiff neck or stiff back. Body aches with flu-like symptoms. Eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. Your risk of serious infections may continue for several weeks after your last dose of EMPAVELI. It is important to show this card to any healthcare provider who treats you to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated against serious infections caused by encapsulated bacteria, and that you receive antibiotics if you need to start EMPAVELI right away, and you are not up to date on your vaccines. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have a serious infection caused by encapsulated bacteria, including Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B when you are starting EMPAVELI treatment. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. If you have PNH and you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion and can be life-threatening. Stop your EMPAVELI infusion and get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, wheezing, swelling of your face, tongue, or throat, feel dizzy or faint or pass out, fast heart rate, nausea or vomiting, feel confused or anxious, skin reactions including rash, hives, and itching. The most common side effects in adults with PNH treated with EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash. The most common side effects in adults and children 12 years of age and older with C3G or primary IC-MPGN treated with EMPAVELI are injection site reactions, fever, common cold, flu, cough, and nausea. These are not all the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. Talk to your doctor for information on EMPAVELI. please see important safety information, including boxed warning regarding risk of serious infections and the accompanying full prescribing information and medication guide.